Mr. Kodebinger about his honorary introduction about me. Today I would like to talk about percutaneousvertebroplasty and then kyphoplasty, which they are very common procedures for the osteoporotic compression fractures. We will take a look at the manner of the evidence-based perspective as the title of this symposium. So my outline is I will start with a brief information about those procedures. We will take a look, of course, with the evidence-based perspective, and at the end, we will conclude. As an aging population, osteoporosis and associated fractures are becoming a very important health issue. Due to those fractures, severe pain, reduced daily life function are very common. Fragility fractures due to the osteoporosis are playing a financial strain up on the healthcare systems, which is very, very important. Thus, the treatment of those fractures are challenging, especially in the elder population with the comorbidities. Historically, the bed rest, pain medication, bracing, and then the physiotherapy considered as the conservative treatment of those fractures. We know that from the ancient times that people are trying to correct the spinal deformities, but in the 21st century, with the developments of on the imaging technology, minimal invasive spinal surgery has gained a popularity. One of the results of the minimal invasive spinal surgery developments is the percutaneousvertebroplasty. This is a procedure which has been introduced to the society in 1987 by a French group just trying to treating the cervical hemangioma. This is briefly injection of a bone cement to the compressed vertebral body in a percutaneous fashion. Still, there are some controversies about what causes the early pain relief, what affects the early pain relief on those procedures. It has been addressed that the mechanical stabilization, chemical toxicity, and then thermal necrosis may be the main reason of the early pain relief. According to a review study that regarding to the vertebroplasty, between those years, 1997 and 1999, there had been like 3 studies per year. But after a huge interest on those subjects, the recent 2 years, they just 10 times higher than the normal studies number. So high popularity and interest on vertebroplasty is just arise some question on the researchers to modify with the idea with the idea of restoration of vertebral height. So they introduced kyphoplasty into the scientific research area on 1998. This is very simple. It's an inflation of a balloon in the fractured compressed vertebra, and after subsequently it's just followed by the injection of the bone cement into the restored height vertebral body just to provide some stiffness. But still it keeps the costs are higher than the vertebroplasty. So we all know that if we come to the evidence-based perspective, which is the title of today's symposium, evidence-based medicine aims to apply the best available evidence gained from the scientific method to medical decision making. Randomized control trials are the milestones of the evidence-based medicine. We all know that this is when we are doing a study or just publishing the results, this is only an approximation of truth, but still it can be considered as the best we can do. As Professor Bünger just mentioned, the grace of recommendation is very important when we decide which treatment is the best for the patients. Level A evidence with good evidence just can be provided by the RCTs, the randomized control trials, with the consistent findings. And we still sure that there is a lack of evidence on those subjects. Several studies regarding to vertebroplasty and kyphoplasty for osteoporotic compression fractures have been published on the literature. These are case reports, meta-analysis, reviews, retrospective studies, non-randomized control trials, and then the randomized control trials. I just make it bold because it's still we are lack of the randomized control trials on those subjects. As Professor Bunger mentioned, that orthopedics are one step behind the other disciplines, just producing randomized control trials with the number of the 363 the last 10 years. If we look at the PubMed between the 1984 and then 2008, only 74 studies regarding to vertebroplasty and outcomes for osteoporotic compression fractures has been published. And only one of those studies is considered as grade A or level 1, comparing with the vertebroplasty to conservative treatment, with just indicating that the early pain relief is significant on the vertebroplasty. Between 1998 and then 2008, 35 studies regarding to kyphoplasty and outcomes for the osteoporotic compression fractures are published in the literature. And none of those is considered as level 1 or grade A, comparing kyphoplasty to conservative treatment or kyphoplasty to vertebroplasty. But recently, the last year, the things seems like has been changed a little bit, and 4 new high-quality randomized control trials, which can be considered as a grade A recommendation or level 1, has been published on the scientific area. 2 of them was comparing the kyphoplasty to conservative treatment and then kyphoplasty to vertebroplasty. The other 2 is just comparing vertebroplasty to a placebo control group. This was the first study which has been published in the Lancet on February 2009. It's a multicentral randomized control trials including 300 patients randomized for both to kyphoplasty or a conservative management. And as we can see the results here, that they had a significant effect on the disability scores and also in the back pain score. But still on those studies, there are some pitfalls and then the key points that we need to consider. First key point is the kyphoplasty have a superior pain relief and physical functioning compared with conservative treatment at 6 months and then the 12 months. It's comparably long-term result that if we compare with the other studies which they have done it before. However, early pain relief is more significant for those who have kyphoplasty, but they wish to also indicate on that study that early pain relief is very important. But if we look at the pitfalls of this study is actually they lost 12% of the patients at the 1-month follow-up, and after all they lost 22% of the patients in the 12 months follow-up, which is a quite high percentage for if you are just making a randomized control trial. And the other point is just they couldn't standardize the conservative treatment management between the centers, which can be questioned as a limitation of the study. And also the selection bias of the patients. They indicate that among the 1,800 patients, they only included 300 patients, which they are telling that 141 patients just excluded without any reason. That could be very important. The other one is just published on June 2009 in the Osteoporosis International magazine. Is from Taiwan. They were just comparing the kyphoplasty versus the vertebroplasty. This is also a prospective randomized study. They found out that both the procedures are significantly better outcomes in the pain, but between those procedures, they don't have a significant difference, just providing an early pain relief. But they both found out that they have a significant difference in the vertebral body height, just providing a good vertebral height restoration. Still, this can be considered as a good number with 100 patients, which has been like 50-50 randomized for both treatments. And the radiographic assessment were made blinded, which could be a positive point of the study. They found out the pain status similar for both groups, and there is no significant difference at any stage from pre-op to final follow-up. And they point out that the kyphoplasty have a superior capability of restoring vertebral body height. And the pitfalls are, again, the selection bias of the patients. They still need to verify their exclusion criteria, which can be considered as that. It's a really hard job, actually, when you are trying to make a randomized controlled trial, to ask for a patient with a severe pain, asking for them to participate in a study, if they wish to have a procedure or just to go for another one. So this is a really hard task for the researchers. And another point is they have only followed up for 6 months, not 12 months. And if we come to the vertebroplasty with the placebo control group studies, actually those two studies, which has been published recently in August 2009, has drawn a worldwide attention, both the scientific areas and also the media. As we can see in they have even given under the title of those, under this title, is a common medical procedure unnecessary in the CBC Evening News, and has drawn a very, very important worldwide attention. The first study has just came from Australia. It's again a multicentral randomized study. This is a buck binder. They made a sham procedure for the conservative group, and they made a vertebroplasty for the other randomized group. As we can see on their results that they have a really similar overall pain and then the disability score. So they included that there is no such difference between the vertebroplasty versus the placebo group. Actually, if we look at what was the positive points of those studies, this was the actually first double-blinded study, and with the 78 patients, there had been no randomized control trials have been published before regarding to vertebroplasty versus the placebo with the 78 patients, and of course this is the first study with the placebo group. And the other things that if you look at the pitfalls, then the placebo group involved the injection of a short analgesic to the facet joints, which can arise some question marks on our minds that it can affect somehow the early pain relief on those patients. And again, they had a selection bias on those study. They just assessed like 468 patients for eligibility, and they just declared that the 141 is to participate. The other study is the randomized trial of vertebroplasty for osteoporotic spinal fractures, which has been published in the New England Journal of Medicine again, as they also figure out that there is no such difference between the pain relief and then the disability scores regarding to the vertebroplasty versus to placebo. So this study also can be considered, because they just published at the same time on the same magazine both studies, and can be considered as the double-blinded first study, and they had a really huge number, it's 131, and then they couldn't differ any bit pain relief or the disability scores between the groups. Actually, they had a high crossover rate on those study, which can be considered as a limitation. Again, they also made an analgesic injection to the facet joints, which can be considered as a question mark. And they had like only 1 month follow-up for those patients because of the high crossover rate. And still they have the selection bias, which can be considered 300 is a very good, big number for those, the 1,813 patients, which assess for the eligibility, because it would be really nice if they conclude with this number and their pain severity, which can be decided if they had the same pain severity with the patients who has been included for the study. This is one of our studies, and this is like the preliminary results of our study, which we have done it in the Aarhus Spinal Research Lab with a clinical group. We had really small number of patients, but we still have an early pain relief regarding to the mean pain scores. So it's just shed a light on our minds to go for this subject, and we establish a new randomized controlled trial with the vertebroplasty versus conservative treatment, which we will start to include the patients this month, and probably we will conduct with a cost effectiveness study. And the conclusion, finally we can say that for the kyphoplasty, higher costs still keeps the importance for comparing the vertebroplasty, this procedure. And for the vertebroplasty, even though those two recent major controlled trials with the placebo groups have some pitfalls besides their key points, we cannot underestimate their power on the scientific research area. Both studies have questioned the belief and then the confidence on vertebroplasty, but developments, modifications, and the focused interest on minimal invasive techniques as vertebroplasty and kyphoplasty require a new high-quality randomized trials with long-term follow-ups, and orthopedics are still hungry for evidence.
Thank you very much.